efficiency that our technicians are now achieving that we didn't have before with doing perimetry.
The faster perimetry program for many of my patients has really increased patient acceptance and reduced patient frustration with perimetry.
The ability to generate all the information very quickly on the screen, both in terms of the actual test results that day, but also looking at the trend analysis over a period of time.
And what's really neat is all the old Humphrey fields can be imported into the EyeSuite, so you can compare those with the Octopus that was done that day, so you have a meaningful ability to analyze change over time.
The progression analysis tools, which are quick and easy to use and help to very quickly allow me to identify areas that may be at risk for progression.
Somebody that we're monitoring and we're worried about whether they're stable or not, and say, look at all these visual fields we've done over the years. You were stable here, but look, this area seems to be getting worse. I show them the areas that I'm concerned about, and patients really appreciate the kind of visual aids and explaining them to a level that they can comprehend with these visual aids that they're getting worse.
I believe the Octopus with EyeSuite system helps us be a cutting-edge glaucoma practice, and I think patients are impressed, and patients feel that they're getting the best quality care, which they are.
The top two benefits for Octopus with EyeSuite are, and I don't want to underemphasize this at all, it works. It's an application which, in this particular setting, in my office as well as the offices of my colleagues, it works.